I'm Dr. Lippy, and this is Dr. Jeff Levin, and we're going to discuss a new syndrome today. We're going to discuss the Long Prosthesis Syndrome, and we're really giving it an official name today. Dr. Levin, you and I have talked about this. Dr. Levin is a dentist who practices in Toledo, who had a stapedectomy 15 months ago.
Right.
And he had some real problems afterwards, which I'm going to let him describe. When we met, his symptoms were exactly the same as about 4 patients that I had seen previously, but about 5 or 7 or 10 years apart. So I have written about the Long Prosthesis Syndrome, but only like a little sentence. I wrote it in Daryl Brackman's textbook. I wrote it in an article on revision surgery published by the Journal of Otology and Neuro-Otology, and it was published as one of the papers from courses that we gave. So when Dr. Levins and I met, and he told me his story, I had an immediate impression of what was wrong. So Jeff, would you describe what happened to you?
I'd be happy to. Let me preface it by thanking you very much for giving me the opportunity to talk about this, because I think the recognition of this problem may help others who may be in a situation that I was in. As I said, July 22nd of 2008, I had a stapedectomy procedure in the left ear that I had anticipated would go well. However, immediately post-op, I developed severe vertigo problems. The follow-up with my surgeon that did the original stapedectomy, who, by the way, was a very accomplished surgeon, worked for a well-respected clinic in the Michigan area.
So at this point, you had a total deafness in the ear. You were both dizzy at times where things would go around and unsteady. But then, in spite of that, you, after a while, started back and were working again.
Right. I did get back to work gradually, but during my time in the office, I have a great staff, and they helped me with the compensation of this loss of hearing. They altered my schedule. They scheduled procedures that I would be good at. I also needed a lot of help with helping me to interpret what patients were saying, and most importantly, helping me with the dizziness and what I've come to realize was my memory loss. They would have to basically direct me. I would often forget that I had, for instance, a lab case to write up, or that I had left a patient in room 3 that I had to finish up doing a check on. So they would come in and say, Dr. Levin, you have to finish up what's in there. They were very kind to me, but it was, I owe it to them that they helped me get through all of that. I also noticed that I quite often used sticky notes, and I would write important things that normally I would have put it in my head, and I would tuck those into my pocket, and so that at the end of the day of work, I'd rifle through those to take a look and see if I've accomplished all the tasks I had for the day, and those that I had to take care of that night I would take home with me. So I had that little brain power in my pocket.
Didn't you also mention you had a problem with telephone numbers?
Well, like I said, I had a problem with things that not only were immediate, but some of my long-term memory was lost too.
Talk a little bit more about the memory loss. The story your wife told me about when you would take a nap, for example. Tell me about that.
Right, I could be in what should have been a familiar place, but because my timing was so off, that I would wake up and couldn't orient myself to. I would forget where the how to get to the bathroom, phone numbers, birth dates, what day it was, what time it was. Those were all memory loss items. There were several items that I should have known quite readily that I had a loss of memory. I also had a hard time concentrating and focusing on one thing at a time, and that is something that was very necessary, especially in my job. I needed to be able to focus and forget about other things, but I was quite often distracted. I felt it was probably due to my condition, but really couldn't put a handle on why I was having problems with concentration and having problems with memory.
When we met also, I don't know how it came out, but you told me that one of your activities was doing yoga, which I'm going to ask you about a little bit later. And I can tell you that in working up Dr. Levin, the CT, I agree, looked like the prosthesis might be a little long. I was surprised that in a dead ear there still was some activity on that side when we did our calorics, but it was certainly a dead ear. So we did the surgery, and I took out the prosthesis. It was a 4.25 Schutnick prosthesis that the surgeon had placed, and we took it out and measured it, and it was 4.25, so it was not too long. The next morning, my receptionist rang me and said, "Dr. Lippy, Dr. Levin is here. He'd like to talk to you." And I said, "Wow, he's that mobile the next morning, so send him in." So he walked in, and what did you do?
I did a yoga position called tree, which is a position where you stand on one leg and keep your balance. I was able to do that. I could have done it all morning until my muscles gave out, but I was surprised that I could do that so readily. We had actually in the hotel room in the morning when I got up after surgery, both my wife and I were just overjoyed at what I could do. I could close my eyes, spin myself around, and I had not only a sense of balance, but before the surgery I had a fairly keen sense of direction, which I had totally lost, and that was restored almost completely, in that I could, with my eyes still closed, I knew where she was in the room, and with my eyes closed I could walk straight to her and stop just in front of her, knowing where she was within that space. That was remarkable.
And how long did it take your concentration to return and your memory to return?
Those were also both surprisingly quick. The notes in my pocket, I could empty my pockets right now. I could show you. I don't have all those little notes in there that I had before. The ability to get back to work and resume a more normal schedule was pretty rapid. That would be evidenced by looking at my schedule book. I think my staff was much happier with me at that point. The ability to concentrate or to focus during the day was good. I was able to keep up with many of my routine tasks much better. Still have to compensate for loss of hearing. Yeah. That creates some disability for me. The sense of vertigo, again, what I would call the rotational motion of the space around me, was gone. Prior to that, I could be sitting at this table and all of a sudden I will grab on because I'll have a sense that the room is moving backward. But after the surgery, I've never encountered that since that time.
So to summarize what he has said is that he had both vertigo and an unsteadiness that were horrible, lack of concentration, and loss of memory. And this is the syndrome. Lack of concentration, memory loss, and disequilibrium. Now, what makes this whole discussion more germane right now is you and I talked about also a patient that I operated exactly a month after I operated you. And this was a lady from North Dakota who had had surgery 2.5 years prior to my seeing her. She was working on her PhD in music and was on her last 2 courses. She had a stapedectomy, lost partial hearing, but had these exact same symptoms: disequilibrium, couldn't concentrate, and couldn't remember. When she was giving a piano lesson, for example, she had to stop because she couldn't remember the name of the pupil that was sitting there, yet alone the piece they were playing. And with her own music, the same thing happened. She just couldn't remember. So she never did finish the PhD. She would also, a very simple fact she couldn't remember. Her husband told me he would ask her, what's 12 times 12? So she had a terrible problem. Hers went on for 2.5 years. And she wrote to me, and she described the 3 symptoms we talked about here: disequilibrium, lack of concentration, loss of memory. So we operated her about a month after we did you. Her husband happens to be a pilot with Delta, but they drove here, and they stayed overnight, and I called the motel the next morning because I was so anxious to know how she had done, and I didn't want to call too early, and they said, oh, they left here 2 hours ago. I said, wow, she must be feeling pretty good if, you know, they left 2 hours ago, because she sure wasn't feeling that way yesterday. And they called me when they crossed the border from Indiana into Illinois, and they were both laughing and crying at the same time. She said, my husband's giving me all sorts of math problems, and I'm answering him. She said, I can give you 25 telephone numbers. I couldn't remember 2 before. I feel great. I'm moving around in the car. My unsteadiness is gone, and I'm absolutely back to normal. So it was your exact story, and capsulizing is shorter, but the exact thing. So we thought it was worth putting this on video, because there have got to be lots of others out there. If I've seen 6 and the results are this dramatic, we wanted everybody to know about it. So if you've got this patient with disequilibrium, memory loss, and lack of concentration, they may have a long prosthesis. Now, let me add this one important thing. It doesn't mean that the doctor put in a prosthesis that was too long. It means the prosthesis is too long for that patient. Because in measuring the prosthesis, it was what he said and what we should. It wasn't the mistake in the prosthesis. It was that his was too long for Dr. Levin, and hers was too long for her.